Hello, everyone. I'm Michelle Kidd, and I get the pleasure of kicking off our call today with the spotlight for this call. And today we're going to focus on true collaboration. So all 6 standards will be a spotlight call because we want to make sure that you've incorporated each of the standards into your project. But today we're starting the series with true collaboration because, after all, we are part of a collaborative, right? So we know that AACN's critical care nurse work environment surveys demonstrate that collaboration with physicians and administrators is among the most important elements in creating a healthy work environment. True collaboration is a process, not an event. Without the synchronous, ongoing collaborative work of healthcare professionals from multiple disciplines, patient and family needs cannot be optimally satisfied within the complexities of today's healthcare system. So extensive evidence shows the negative impact of poor collaboration on various measurable indicators, including patient safety and outcomes, patient satisfaction, professional staff satisfaction, and cost. So that is why we must be relentless in pursuing and fostering true collaboration, and why we're starting the standards with true collaboration. So today we're co-learning, and this is part of the collaborative. But do you remember, for those of you that got to go to Chicago for the in-person meeting, when Brenda talked to us about putting on our healthy work environment glasses? So we want to look at all of our projects with our healthy work environment glasses. But today I'm going to ask you to get out your bifocals, and then we're going to focus in on true collaboration for today's spotlight call. Now, I just recently read an editorial in Critical Care Nurse that discussed the anatomy and physiology of true collaboration. When we think about the adjective true, it describes the act of collaboration by exemplifying the intentional effort required to create and sustain healthy work environments where everyone, regardless of their role and their title, can contribute to meaningful ways to accomplish our shared outcomes. And then collaboration is related to the behaviors and the actions that we demonstrate to promote our collaborative environments. For the physiology of true collaboration, there are 5 steps. And the first step to foster true collaboration in the workplace involves becoming more aware of how behaviors and actions affect others. The second step then is closing that perceptual gap between roles and allowing the team to gain insight regarding how our stakeholders, so our colleagues, our peers, our teammates, describe collaboration, because everybody thinks of it a little bit different. The third step is the fun part. It involves celebrating collaboration. Number 4 is promote our shared expertise, because we all have expertise in different areas. So we want to make sure we tap into those with diverse experience and backgrounds and expertise. And the 5th step is promoting collaboration by acquiring team skills. And we can do that in numerous ways. But what we're going to do today is talk about how to accomplish some of these steps in the next few slides and share some different examples. So going back to our in-person meeting, we're going to review what we learned in Chicago about the IHI model, as well as, I mentioned, provide some examples of how we can ensure that we infuse true collaboration into our everyday work in our projects. True collaboration is ongoing, and it's built over time. And eventually it results in a work culture where communication and decision-making between healthcare professionals, as well as among nurses themselves, becomes the norm. In a healthy work environment, each professional is respected to achieve optimal, safe, and quality care for our patients. Skilled communication, trust, knowledge, shared responsibility, mutual respect, optimism, and coordination are integral to successful collaboration. So in our projects, we need to engage individuals who are most likely to benefit from the quality improvement project and defining our aim. So you've been working on this part already, but keep in mind, we also need to think about teams and individuals who are impacted upstream and downstream, or that balancing key measure that Brenda taught us about. Now, what do I mean about this? I am going to share a project that I worked on for my DMP. And what I did was I implemented a good sleep bundle. So for those of you in critical care who know about the A to F bundle, I added a G for the good sleep bundle. And this was ultimately for our patients, obviously. But in order to do this, I needed to take time not only to think about the patient, but other teams who had a service to provide to that patient. So like respiratory therapy, lab, radiology, providers, pharmacy, our night shift staff. Collaboration was essential in order to not disrupt services or processes and care that these professionals needed to provide to the patient. So we came together to discuss sleep promotion and consider everyone's unique perspective and contribution so that we could brainstorm and work together to implement our good sleep bundle. We left our credentials at the door and we were there for one purpose, the patient. Now, I really thought this would be the hard part of my project, but as we all knew this was best for our patients, we were able to come together with a clear aim and an open mind, and we're able to craft our plan. So a recent article from Becker's Healthcare discussed a common theme of the top 100 hospitals and 15 health systems. And what got them there, it was a vision that mobilizes the organizational will and sets an organizational North Star. So when organizations believe they can do it together, they can get the alignment and transparency needed to succeed. Once you get employee engagement and buy-in, you start to see the reductions in variation in processes and costs. That virtuous cycle begins, which gets the quality cycle spinning. So referring back to the good sleep bundle and the perceptions of patient sleep before and after the bundle, we were able and actually thrilled to see a positive statistical impact on patient sleep. We all worked together to achieve those goals. Nurse and physician leaders are equal partners in modeling and fostering true collaboration. So in my project, I partnered with our ICU medical director and a resident who had an interest in my project, and we filled the role as the system leaders. But I also had process owners in our ICUs that included day and night shift nurses and respiratory therapists, our patient liaison, unit secretaries. Don't forget your unit secretaries. They are super helpful. They see everything, they hear everything. So don't forget them. And then our therapy champions, so OT, PT, speech. And they helped drive the project 24/7 because we can't always be at the hospital every day at all hours. So this project no longer became my project, but it became our project. And we became the sleep team. So we also know we're not all experts in quality improvement processes and data analysis. We need to think of experts who can assist us with quality improvement, data collection, analysis, subject matter experts, etc. So in the Good Sleep Project, as the critical care CNS and the DMP student, I filled the subject matter expert and the data owner role, but we also collaborated with our nurse scientist, another person, if you're lucky enough to have one, who's very beneficial to be on your team. They can help you with your project, help you set up your aim, your objectives, and your goals so that it all ties together. We also used our quality coordinator to help with data collection, data. Sometimes it's hard to find the data, as you know, and help us get that organized in a way that we could present it to our teams. We also used our operational excellence team, which was a team devoted to project management through the use of change management principles to fully optimize our team's processes and outputs through continuous improvement. Now, these team members did not routinely attend our meetings, but they did help us and coached us through some tricky spots when those came up. Before even starting the Good Sleep Bundle, I met with our Associate Chief Nursing Officer and our Chief Nursing Officer just to discuss the idea. They love data, so I had to submit a project plan and the outcomes we would track. And then over the course of the project, I provided them with regular updates. The team sponsors were there to help break down barriers and support our work. Sometimes you just need that little extra oomph behind your project to make it a priority or to help it get attention that it might need. And then a fun thing, I just recently learned that in that hospital, the CNO had mandated that the Good Sleep Bundle would spread throughout the whole hospital for all patients in some form or fashion, which is really the goal of our projects and our work. We want to share and spread that so that others can benefit from it, and that we can spread our outcomes throughout either the hospital or your entire healthcare system. So just to kind of summarize what I wanted to bring to your attention is that the domain of true collaboration is best expressed as a deep passion and commitment to fostering relationships, teamwork, and collaboration. Trust is what helps navigate boundaries and creates a sense that everyone is doing his or her part to serve our patients, with each working within their own professional scope of responsibility. Collaboration, trust, and teamwork come together to create an environment where healthcare professionals can make their contribution and they feel supported and help to work through those challenges that we face. In practice, true collaboration can actually take many different forms. Intentionally designing these structures that hardwire teamwork and collaboration have really always been important, but in times of workplace instability that we all face these days, they are essential. So I wanted to also give you some resources that I found for true collaboration just for my short presentation, so that it can maybe help you in your projects as well. So of course, the AACN website has a page here that is all about healthy work environments, and you can drill down to true collaboration or any of the 6 standards. And within the website, there are numerous articles and webinars and NTI presentations that might help you. For those of you who went to Chicago, we shared what we call the Blue Book, the AACN standards for establishing and sustaining healthy work environments. If you aren't the one that has the copy of that, don't worry, because you can get that on the website as well. AACN has that for download for free, or if you like the hard copy, you can purchase that. I think member cost is just $10. Check out that article that I referenced about the anatomy and physiology of true collaboration in critical care nurse. And then there was just a recent article from critical care nursing clinics about a post-pandemic review of AACN's domains of establishing and sustaining healthy work environments. That's a good one to check out as well. But within these resources are secondary resources. So you can find all kinds of information and help as you work through building your teams.